What are CLL signs and symptoms?
This is a very elusive disease. I mean, that the vast majority of patients are not diagnosed because they have symptoms. The most frequent case is that they are performing tests for other comorbidities, like annual regular checkup, and we identify an increased white blood cell count. And then when we characterize the reason for this increase, the clonal leukemic population emerges, and we can diagnose the occurrence of CLL. So this is usually an asymptomatic disease at the time of diagnosis, and it's one of the rare blood disorders in which we can get the diagnosis without invasive tests like bone marrow biopsy or aspirate, because the characteristic of the leukemic cells are so distinctive in the peripheral blood that it takes only blood sampling to identify the presence of CLL. Then, if and when the disease progresses, patient can develop symptoms. The symptoms in the vast majority of cases are related to the occurrence of anemia or thrombocytopenia, but mostly anemia. The patient can complain about fatigue, and they can develop fatigue while they are doing daily life activities or specific exercises, but this is not something the patients are complaining about the diagnosis. In general, there are no disease-related manifestations. Rarely the patient report the canonic symptoms that are in general associated with lymphoproliferative disorders like low-grade fever, weight loss, and drenching night sweats. These are only reported in a minority of patients, and again, not a diagnosis, but usually at the time of progression, they can be associated with other signs or symptoms of disease progression. And again, at the time of progression, the patient may develop enlarged lymph nodes, and they can be detectable by physical exam or by imaging tests like abdominal ultrasound.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.